right now with what we're seeing. I feel like with Ozempic, the semaglutide, there's definitely in the media this narrative of like, you are going to, if you take that, you're losing your muscle mass. That's all you're losing. To lose weight, you're losing the muscle mass. It's actually not true. Like if you have a doctor that's managing that medication right, you actually can lose body fat and put on muscle at the same time. But there's a lot of people that don't feel like that can be done. I would say you probably think that you can lose body fat and put on muscle at the exact same time.
And I think the problem is they're not working with a high quality practitioner like yourself and your team. They're working with just a general pill prescriber who's just kind of writing the script, sending them out their door. They get their 6 minutes in the office, they walk away. They have no concept of exercise. They have no concept of nutrition. Kind of like, here, take this, come back for your shot, or do it on your own. And, I'll just keep, banging your credit card every, 4 or 6 weeks and keep you on the protocol. And they gauge success simply by pounds on the scale, not quality of life, not body composition, and not even managing their blood work effectively. And, we get a lot of people who come in, they kind of have that Ozempic syndrome, where they've lost the weight, they're super happy, but their lifestyle has gone down. They don't have someone managing it with them. So what we typically say is prioritize protein. Yes. First and foremost, because protein is what is going to sustain the muscle you have and actually give you the opportunity to build muscle over time. Prioritize protein first, and you must commit to a healthy exercise program. The first exercise we say for all humans is walk. Go for a 30 to 60-minute walk every single day. Like, if that's all you're doing so well. And then 2 to 5 times a week, based upon your personal preference, background, and ability, train with a bit of resistance. And resistance for some is simply yoga. For others, it might be kettlebell training. For others, it might be going to, play basketball and multiplanal, ranges of motion, just kind of that more of a plyometric type base. But having that type of physical activity to stimulate anabolism and muscular growth and muscular maintenance and strength and endurance increases. A lot of times people, they take the pill and they stop the most important part of this is the stimulation adaptation, right? You have to send the signal for the body to respond. They don't send the signal to enhance or engage the muscular system, and then it starts to shut down. So I think, to your point, that's a big issue right now. But a lot of people we've seen, they're like, my doc never said that.
Yeah.
He just said, take this and I'll lose weight. Then I'll become healthier because maybe my HbA1c or my fasting glucose will look better as a result of that. But they never talk to that next level. And I think that's a disservice to their clientele or their patients.
Yeah, maybe hammer home for me, like, the importance of muscle mass. Like, we really feel it's the key to longevity. You must maintain your muscle mass. Most people must increase their muscle mass, not just maintain it. But I want you to hammer home that point, the importance of it.
Muscle mass is one of the primary indicators of not just longevity, because there's enough studies now that show declining muscle mass over time is directly correlated to earlier untimely death. The more muscle tissue you have, the more muscle tissue you can keep over time, not just the longer you live, which is known, but the greater utility you have. And think about that. Do you want to be the grandma or grandpa sitting in a rocking chair, driving around in a Rover, unable to get a teacup out of your cabinet for fear of falling down, breaking your hip, and then, 3 to 7 months later, maybe dying as a result of that? Because we know that's the data. That's what the data shows. Yep. As muscle breakdown continues from about the age of 30, 40 through the 60s and 70s, humans are losing so much muscle tissue, they become so frail that the smallest little activity can actually hurt and harm them with life-changing, life-ending results. The maintenance of muscle tissue, I think most importantly, ensures that we as humans are now engaging in physical activity that is affirming the anabolism instead of catabolism. And what is that? Anabolism is the growth mechanism of the human body. We are constantly growing and regenerating. We are stimulating further growth. When we stop stimulating further growth, we immediately switch over and we start to initiate catabolism, which is the eventual decay and degradation and then untimely death. So the more we exercise, the more we sustain our muscle tissue, even build muscle tissue, the more we are affirming our will to live and thrive.